Hi, everybody. This is Brian Wolf, and today we're speaking with Dr. Salameh in regards to the 7 mistakes of highly scared dental patients when they're searching for a dentist and how to avoid them. Good morning, Doctor.
Hey, good morning, Brian.
You know, one of the things that I wanted to bring up right away was the anxiety factor. It's kind of like when people first come on the air here, you know, they get a little scared or whatnot. And when people go to the dentist, I've seen them like be afraid to even walk in the door. So how do we address that?
That's a great question. And the point of understanding of anxiety is it's an emotional response. It's nothing really you can touch. So, and that's where the importance of understanding it. You know, I'll tell you a simple story. When I first graduated from dental school, you know, the first patient was like my brother, my oldest brother, and he's a physician. He's an OBGYN, very well educated, and he's a big guy, like 6 feet, you know, 6 foot, you know, and he's like a big guy. And like, yeah, cool, let's fix the teeth. And I was a fresh graduate. That's back in 2005, and man, that was a interesting story. I could tell you that.
Yeah, I can imagine.
So he was deadly scared of the dentist.
Really?
He will not sit on the chair. And at the end I spent an hour just trying to even, you know, do anything for him.
Yeah.
And I tell you something, this is a little secret. I had to send him somewhere else.
Really?
I couldn't even work on him. And that really was the trigger for me.
Mm-hmm.
Because first I was like, he's a normal person.
Mm-hmm.
I never thought he would be scared of the dentist. And he's like physician even and all of that.
Yeah.
But the second he sat on the chair, so I knew that something more of emotional, something happened to him over there. And to be honest with you, it's all about also personal perception of the person himself, not the dentist. Because I was trying to say, like, hey, you're fine. I mean, come on, I'm not going to hurt you. It doesn't matter.
Mm-hmm.
If I'm scared of a dog or a cat or something, I mean, everybody's looking around me and saying, oh, this guy's, it's even stupid being scared of simple things like that. It doesn't matter. It's an emotional response we have.
Right.
And it's just a person, it's a own perception. We have to respect that when we come to anxiety and fear.
Right.
And dealing with it. And that's why I personally spend the last 15 years just to try to understand what's the best way to approach it and that's why we're doing this audio, because I wanted to make sure that we dive into the details and make sure we provide, some clearance about, clarity about the mistakes and how people will avoid them, so I don't have many more like my brother.
Right. You know, and that brings me up to a good question. You know, a lot of people that will be listening to this, they may have questions, but really, who should listen to this particular call?
Yeah. So, if you're really sick and tired of being stuck in what we call an anxiety sinkhole, you hate the dentist.
Mm-hmm.
Every time you go to the dentist, you say, "Oh my God, I hate this. I hope this will not be painful or something."
Mm-hmm.
If you're sick and tired of feeling embarrassed and losing your own self-confidence just because you can't smile, every time you smile or laugh in a group of people, you're putting your hands over your mouth.
Right.
But the problem is, anxiety is keeping you away from fixing the problem. It's like a major barrier for you. You'll benefit from this message. If I want to make sure that if you have some momentum there, you like, I want to take over, this and fix my teeth and be able to chew when I go to steakhouse. I'm not worried about my teeth coming out of my mouth. But it's only being scared is what's stopping you.
Right.
You'll definitely benefit from this message. Absolutely.
That's great. And the other thing is, by the end of the call, when it's all said and done, what would you discover, or what do you think people should discover by the end of this message? When they hang up, they have X in their mind.
That's great, and which is interesting. So I just want to save people time. Before even we jump to that, to answer your question, is if you have a great dentist, if you're not scared of the dentist, and you just enjoy getting dental treatment, this is not for you. Just save yourself some time and just go listen to something else. If you're just looking for a quick cheap fix and just wanted to get a quick cleaning, we're not talking to you. Unless you're really scared and can't get to dental treatment, this message would be good for you. So to go back to your question, Brian, At the end of this call, I want you to have a full knowledge about the problem and what causes it and how and the ins and out of it. And knowledge is power. That will help you. The first step of overcoming a problem is to know there is a problem.
Right.
So we'll talk about that. And I want to also to teach you how to find a dentist. There's a lot of dentists on this, and I wanted you to know how to find a dentist and what mistakes you avoid in that search. So you end up with a dentist that understands, your talk, understand how, I take you seriously when you talk to them and take your anxiety seriously.
Right.
And that's the most common mistakes we see is everybody's, we'll talk more about it in the details. I'll get to that. And how to avoid these mistakes. And another information is there really a magic wand to fixing these problems? Like, if you're scared of the dentist right now, is really a magic wand that we can do and it's quick fix in the same day? And if there is really one like that, what it is, we'll talk about that at the end of the call.
So a Hogwarts dental plan, right?
Yeah.
Hogwarts and Harry Potter.
Exactly.
All right. Well,
awesome.
Let's do this. Let's get started, though. In regards to why people are scared of the dentist. Why are they so scared that they have these feelings that they can't? I mean, it's like it's petrifying for some people. Why do they feel that?
Yeah. So if we look at the surface, there's really two main reasons. It's either they had a major direct experience when they were kids, and that's what we hear most of our patients say. My dentist never really numbed me very well. They will never stop, and when I'm working, and they had a bad experience before, and and that's kind of that's our psychology as humans. If you got a bad experience one time, even all of the benefits of overcoming it, you'll step out. That will still stop you from doing it.
Okay.
So that's usually, the majority of people. They usually had a bad experience, and they just don't want to put themselves in that spot again.
Gotcha.
The other percent of people is actually indirect, which basically they hear a lot of horror stories. They hear it's like, oh my God, root canals are scary. And they never. You ask them like, have you? It's like, no, but my mom, told me about it, or they seen their mom or parents going through it. So what used to happen is actually, and that's extremely important, don't take your kids to your own dental appointment because they're looking at you.
Really?
And that's actually, if you're not, even if you're just some discomfort, they are seeing that as pain or something.
Yeah.
And now they are growing up scared of the dentist.
I never thought about that. Yeah.
Yeah, so that's indirect. It could happen from just listening to stories. Mass media too. If you really look at the dentist, and we're known as, the one who caused pain, seriously, if you look at the news, all of these cartoons and everything, the dentist is always causing pain, and he's always, trying to, for some reason. So it's also, we're well known in the media about it for some reason. So that actually goes deep into our minds and put a special print right there.
You're right, actually. You're right.
Yeah. So, if we really look at that and now take it to a deeper level, and when that happened, when you have a bad experience, what's really happened? What people are scared of to the dentist?
Yeah.
It comes to a couple of reasons. And number one is you mentioned something. It's the environment you're in.
Yeah.
So people are scared of anything that causes pain.
Yeah.
So injections, right?
Yeah.
Everybody doesn't want to get an injection because it causes pain.
Right.
Everybody who hates noise. I mean, the noise of the drill. That's definitely. So these are the number 1, 2, 3, which is noise, as you said, Brian, earlier. It's leading factors. The noise is so environment is important there. Pain, they just don't want to feel the injection. We have nurses who give injections to people all day long, and the second it comes to their mouth, they're scared. It's like, I can't because it's inside my system.
Yeah.
So that's kind of the first thing they are scared of, or they're scared they're not being numb enough, to have. Most people don't complain about being over numb. Like you don't hear people saying, I know what, I went to the dentist and I was numb. Yeah, that's okay.
Yeah, right.
But they are not numb enough and feeling some pain. That's definitely a major reason.
Okay.
The other reason is, if you think about it, you go to the dentist. We as humans like to control things. We like to be in control all the time. We don't like to lose control. You're driving your car, you're driving it, you're in full control of your, of the drive seat, right?
Yeah.
You go to the dentist, You had no idea, what's going on with your teeth. Your knowledge about teeth is almost zero.
Right.
And you go there, and they put you on a chair. They lay you to the back, and that dentist and staff is right. You lose control. The feeling of loss of control right there.
Yeah.
That's very scary.
It is.
Including myself. I don't like people to be like into my head and into my mouth like that, and at least I don't know what's going on. And we dentists, to be able to do our job, we had to bring even more tools into that. So,
right.
So that is actually, and the reason why I'm mentioning this, because the first, treatment or the first way to recover from being scared is know exactly what really gets you scared.
Right.
So if you know this is the point, or the pain, or the injection, if we can zone in into one thing, that would be really easy to fix.
Right.
Now, you could be scared of anything. You just hate the dentist. That's a different story. We'll talk about it.
Okay.
The other thing is the dentist himself. It's very important that, you're going in again, and you don't know much about this topic. People read a lot about their, physicians but the dentist and teeth, there's not a lot of knowledge, and that's why we're doing this.
Right.
And physicians, they talk to you from a distance, but dentists, they actually engage your face. Right into your face, right into your mouth.
Yeah.
And to do that, you have to have a good trust with that guy.
Agreed.
And that's the point. So there is some people who's like, cannot trust that dentist. So the dentist doesn't have a good, trustworthy communication skills or something.
Yeah.
That will create a bad experience for the patient.
Yeah, I can see that.
So that's important. And the last thing, to be honest, which is very interesting, we talked about it earlier before this call, me and you and Brian, is feel of being embarrassed.
Yeah, absolutely.
Being judged. A lot of people had a bad experience, and they just skip going to the dentist.
Mm-hmm.
And what happened is it just goes over time, and even if their teeth had no problem, but they don't want to go back because they don't want to hear the dentist say, "Hey, it's been 6 years since you came in, and they being lectured."
Right.
That actually is one of the leading causes why people are actually scared of the dentist, which is very interesting.
I can see that actually, because people don't like to be judged.
Absolutely.
So I can definitely see that.
So if we really, put this into, if we put all of what we just mentioned into one idea, we call it the anxiety sinkhole.
Okay.
So you go to the dentist, you had a bad experience, you had a painful injection, not enough Novocaine, not enough, numbness, feeling the pain. The dentist is not stopping. He tells you to just let me know, raise your hand, and to stop, and he will never stop. He just keeps going. So you lose trust with that dentist. You're being judged by the dentist and team. Your teeth are broken down, and you're like, no, you should have taken care of. You're just being lectured.
Right.
And all of that is creating the anxiety, and then you start skipping dental visits. And that's the first thing everybody would do, start skipping dental visits.
Absolutely.
And then we go to, unfortunately, just like buying a new car and say, I don't want to do oil change. Things will start getting bad.
Yep.
So that will happen is teeth and gums. Even if you're doing the best cleanings at home and all that, it doesn't work. You have to see the dentist, and things would start getting worse.
Sure.
You don't want to be more judged and more lectured, so you keep skipping. You end up with more bigger problems. You're more scared about it now because it will take more to fix it.
Right.
It will be even more expensive. Now that kicks another level of fear, which is the money fear. People think the dentist has, that's a fear part of the deal. It's too expensive. I don't want to even go. That's a fear. That's a fear by itself.
Right.
And you go into the low confidence and cannot smile and no food, and you will go 10, 15 years. You cannot smile. You cannot eat. Just because you don't want to go to the dentist, just because you're scared of these simple things. And if we really put them down, if you can, and that's where we're coming to, at the end of this, is the mistakes and how to avoid them. Because if you can nail these and find a good dentist who help you through this, that whole suffering can end quick.
Yeah.
And it literally can end quick.
Yeah.
So, that's kind of the story here, Brian.
Yeah, I absolutely agree with that, and thanks so much for going through that for a lot of people, because that's going to help them quite a bit. Now, what exactly are the 7 mistakes people make when searching for an anxiety-free dental home, if you will, and how do we avoid them?
Yeah, so the first mistake is assuming that all dentists or all dental offices are they provide the anxiety-free experience. Just like what I did when I first graduated is, I was a dentist and I couldn't even help my brother.
Yeah.
And And the one thing I didn't do is I didn't make it worse for him, so I just sent him somewhere else.
Right.
Dental school, the truth is, all dentists can do dentistry, but dental school is, what nobody's telling you is they're not teaching you how to treat people. They're teaching you how to treat teeth.
Oh.
So, and as we said, it's an emotional problem.
Yeah.
And it's extremely important to have special training, a behavioral training for dentists and staff. Not just the dentist, you're working with a whole team.
Right.
They all need to understand what we just talked about, of being scared and not being judged, and how. So that's why it's extremely important when you're looking around. The first mistake, you think that everybody's equal, and we know that. In our life, like in anything, it's not nothing fits all, right? But when it comes to the dentist, like no, it's it's the same old. No, it's not. Especially if you're scared of the dentist, you need to be very careful.
Right.
You need to make sure you pick the dentist. There is a special continuing education for dentists had to go through. There's a lot of education after school that the dentist had to put himself in to be able to treat, and emotionally engage with the person who's scared of the dentist.
Right.
So that would be the first mistake is the mindset, fixing the mindset how looking for the dentist. I would move to the second mistake is choosing your dentist based on insurance. I love insurance. I think insurance is great.
Yeah.
And but if you call your insurance and say, who should I go to? The only criteria they work with insurance is how to save money, cut costs, and all that, which is great. We use insurance in our practice, and we help our patient use it. But they don't ask you the question, are you scared of the dentist or not? They don't filter dentists.
That's true.
Based on, are you scared? They just treat all of their patients
exactly
the same.
Yeah.
And it doesn't work.
Right.
It's a factor to include insurance. I'm not saying just don't think about insurance. You have to think about insurance, but it's not the only determining factor where to go.
Right.
And if you do that, and what we see all the time, you go to the place, which is good, serving people, which is not scared of the dentist, and you're the only one there who's scared of the dentist. They don't see you like that, and what happens is you go back to this anxiety sinkhole. It gets worse.
Yeah.
Because you push too much to get out of it, and now we're back to the same problem again.
Right.
So insurance is a factor, but it's not everything. So that's extremely important to understand when it comes to anxiety and being scared of the dentist.
Yeah, and most people don't even think about that.
Yeah, and that's why I'm trying to share this message, because we see it. We take insurance, as I said, in our practice, but it's interesting how it's important, but how most people think about it is just the only solo factor right there.
Yeah, that's actually a great point.
The third mistake is you do some research before going to the dentist. I mean, thank God to Google and thank God to all of easy technology now. I mean, I don't blame you 30, 40 years ago because you cannot tell.
Right.
But I personally don't get anything now before I search for it. I mean, it's a simple fact. Just go on Google and search, and not just search, go to the reviews. And you had to see a pattern that these people, for example, they treat anxiety-free patients, and they, you had to hear the word of mouth these days. People doesn't like to talk to each other anymore that much, but it's Google who's kind of doing it to them. You can ask your neighbors and all that, but make sure that you search very well.
Yeah.
If you're really trying to get out of the sinkhole, you have to pick pretty good and spend some extra time, for search. If you're not scared of the dentist, I don't blame you. You just don't go anywhere and you're fine.
Right.
Okay. They may push you to be scared of the dentist. You be careful with that. So that's the third mistake. And one of the things I say, the fourth mistake is, we pick the dentist and we just call them, book an appointment, and just go.
Right.
I think this is a fatal mistake.
Really?
I think you should phone interview the place. I mean, as simple as that. I'll give you a quick hint. You should do it, and that will give you what you want. You just call the place and say, hey, I'm scared of the dentist. I hate the dentist. And just don't say anything else. And see how the person on the other line is treating you.
That's fantastic.
And if he's like, oh, no, what are you talking about? Don't go there. I mean, period. I mean, this is a screening method.
No, that's fantastic.
And to be honest, it's a simple, easy way. You did your Google search now. That's your first filter.
Right.
You fix your mindset. You did your insurance, checkup, and you did your Google search and all of the questions around Facebook. You can post a question on Facebook or something, and then you do your own phone screening.
Yeah.
And that will tell you if that front desk person or receptionist, she's picking up the phone and talking to scared people all day long, she'll be able to answer that. If she's like, yes, we're the best place for this, for this, we'll take good care of you, and that didn't take her a second, you're at the right place.
Right.
They are dealing with this kind of emotional problem all the time. If they're like, okay, what shall I do for you? Then just don't. You're good. That's
fantastic, actually.
So you see, these are simple ones, but they are diddly mistakes, though.
Yeah.
So that's number 4. Let's go to number 5 now, and there is a lot of tools that dentists have that they did not know about before.
Okay.
Sedation and options other than just the laughing gas. This comes to a fact that I personally believe 100% laughing gas doesn't work for adults. It's great for kids.
Right.
But it's rarely work for adults. And thinking that that's the only tool, there is other tools that the dentists have, that will equip. As we said, the right dentist will equip with. They can help you a lot.
Yeah.
If you can do the right search, you should ask about the sedation. But the mistake is always people think is the common, myth is it's very expensive. I don't want to do sedation because it's very expensive.
Exactly, yeah.
But the myth here is it's not all sedation the same. There is multiple levels of sedation.
Mm-hmm.
There is expensive sedation, which we had to use sometimes, but very rarely.
Okay.
There is what we call the magic pill. That's a very affordable. There is a good report that you can read. You can go to sedation911.com and download that report, and it will give you all the details of what we can do with the magic pill and how it's very affordable. It's not that expensive.
Wow.
So just assuming that sedation is expensive, no, it's way cheaper than you think.
Because that's what everyone says with sedation. Oh, it's so expensive, and people don't think about that.
And price is important. Don't take me wrong, but knowing that dental office treating and being able to provide multiple options just for that and making it affordable, that's extremely important. Because guess what? If you're scared of the dentist, every time you're going to go to the dentist being put to sleep, throwing $1,000 every hour, it's very expensive.
Yeah.
And but there is other tools. As I said, go back to the report that I showed you at sedation911.com. If you download that to get some more information, you'll be surprised about that.
That's fantastic.
And where are we at now? Number 6, I guess?
Yes, we are.
All right. So, as we said, let's say you went through all of that, and you made an appointment, and you went to the office.
Mm-hmm.
You're not done with interviewing that office. I want you to understand that.
Okay.
You go and you had to be looking everywhere. You had to look at the restroom. Is it really clean? Are they taking extra? I'm serious about this.
No, it's great.
I mean, if the person is trying to put an effort in something, that tells you he's trying to do something right. If you're just a number over there, that you're not at the right place.
And people do not think about that stuff, actually.
Yeah, I mean, which is crazy.
Yeah.
Because if you should be the more scared of, but sometimes when we go into the scary mode, my wife, she's scared of animals, actually. And when there is a dog right next to her, she just freak out. She hates me for no reason because she's just in that scary mode.
Yeah.
And you can't think right. So I don't blame, people when they don't think right when they are in the scary mode.
Okay.
When you're scared and you feel stuck, you don't think right.
Yeah.
So that's why you have to be prepared for this.
Right.
So when you go in, see how people are treating you. See, are they taking care of your privacy, for example? Are they just, you're another number. When you walk in, you ask the staff, you ask do you guys do this pretty often? If you're doing sedation, when was the last? There is a difference between people who does sedation 50 times a week and one a month.
Yeah.
I mean, that's a deal over there. I give you a simple trick. Even their paperwork should be able. They should be screening you if you're scared of the dentist or not.
Right.
If you fill your medical history about if you had diabetes and all that, and there is not a hidden question there that asks you if you're scared of the dentist and past experience, you're not at the right place. Because if people are focused on one thing and trying to, as we said, it's an emotional fix right there.
Right.
They have to screen you they need to know you before you even walk in.
Yeah, absolutely.
So that's number, is you're not done with your interview till you actually got there.
Yeah.
The last mistake is judging. We're going back to price because it's usually an important topic is judging the place or the dentist based on the price.
Mm-hmm.
I don't say it should be super expensive, but or it should be like super cheap. You had to have an idea that, as we said, with all of these mistakes, comes back to one thing: you get what you pay for.
Yeah.
You can buy the cheapest pizza in the place, but you have to eat it. I mean, that's the deal. I don't think as I said in the previous point, it is not expensive. It's very affordable. You have to find a place that's really affordable.
Right.
If it's so true to if it's too we're trying, and that's the point. You have to get all the points together, and not just shopping on price. If you're shopping on price in dentistry, if you're not scared of the dentist, I'm good with that. You can go to anywhere else. Dentists are doing good everywhere, most likely, and you're good. You'll be in good hands. But if you're scared of the dentist and you're just shopping by price, you'll be in trouble over that.
Yeah, I can see that.
These are. I hope that I provided some value right there with the 7 mistakes. If you write them down, if we go quickly through them, fixing the mindset that not all dentists can treat scared people. That's number one.
Right.
Making sure that you don't just take insurance as the only determining factor.
Mm-hmm.
It is a factor, but it's not the only one. Searching the dentist before and doing some extra research that takes extra time. Going to Google, go to Facebook. You can post a question on Facebook these days, and people will get back to you.
Yeah, you do it for your car. Why not for your teeth?
Exactly. That's great. And then phone interview. This is a simple hint. Just call them, ask a simple question. Just say it word by word. Hi, I am scared of the dentist. I hate the dentist. Try even to, trigger them and see, okay, I hate the dentist, and see how they respond. That will tell you a lot about that place.
Yeah, absolutely.
And then go through, what we said is even when you're going there, you're still interviewing them, asking the team, more questions about the dentist himself. Don't ask the dentist, ask the team. That's a trick. Ask the team, are they happy there? If they're happy there, if they're just, whatever, you're another person, be careful. Thinking that sedation is expensive, you need to know your options about sedation. There is way more affordable ways.
Right.
As we said, go to extra resources we mentioned. And the last thing we talked about is it's not just price. So be careful about that. It should be affordable. I agree 100% in that, but be careful, and just be the sole, determination is the price over that. I hope this was helpful, Brian.
No, this has been fantastic, and I hope the folks that are listening to this call actually really understand that the dentist is not your enemy. They're not out to get you. They're out to actually help you.
Absolutely.
And to make your life better, because people know it. Life is better with a good smile.
Absolutely.
So, thank you so much for coming in today, Doctor. We appreciate that.
My pleasure, Brian. Thank you.
All right.
Take care.